So, if you've gone to a seminar or lecture on quality improvement, chances are really high that you've heard somebody talk about measurement. And when they talk about measurement, they probably have talked about measurement for improvement, measurement for research, and measurement for judgment or accountability. Now, we're not going to spend a lot of time today on measurement for improvement because you all know about that. We want to understand the gap between where we are and where we want to go. We're going to run tests of change and measure whether or not those changes actually result in improvement. That's pretty clear to you, I'm sure. Measurement for research, we often, I think, don't give enough credit. We say that's for the academics, that's for the people who are up at the Harvard School of Public Health at their computer. That's not what we do. Well, in fact, if we're doing rigorous quality improvement and measuring accordingly, we are doing a form of research. But now let's really dive more deeply into measurement for judgment or measurement for accountability, because I think we oversimplify this rather complicated subject. I'm going to discuss 5 ways in which measurement can be used for judgment. The first is benchmarking. Now, what do I mean by benchmarking? It's when we look at hospitals across the country and we benchmark them or compare them regarding their hospital mortality rate. Now, this is a hazardous exercise as far as I'm concerned, because whenever you do that, it turns out that the great majority of hospitals or doctors or organizations are in the middle and they're statistically not distinguishable from one another. Now, some hospitals may be true statistical outliers, and we'll come to them in a moment, but I think that benchmarking, if not done well, is hazardous and potentially misleading. Now, what about measurement for pay for performance? In the United States, at least, this is almost a fad. We're really into value-based purchasing. We're into rewarding or taking away money depending on whether an organization or a doctor is performing up to a quality standard. As you can imagine, if there's money on the line, the measurement better be pretty good. Let me give you an example. We currently have a pay-for-performance scheme in the United States for readmissions. That's an okay thing to think about, but if you have not adjusted the readmission rate for the patient population served by the organization and for all matter of factors that influence that rate, you're probably going to end up paying for performance in a way that isn't fair. A third factor in this accountability measurement is accreditation. So the Joint Commission, for example, accredits hospitals in the United States, and they have data and observations that they take account of when they're making those decisions. That's a form of measurement for a judgment, and we hope and expect that it will be done really well. Then there's public reporting. So when we ask organizations to publicly report their infection rates or their mortality rates, that's a form, again, of judgment, because patients, the public, will look at those data and say, I'd rather go to hospital A than hospital B because it's doing better on the publicly reported measures. Now think back just for a second about what I said about benchmarking. What the public sees is, in fact, asking them to benchmark organizations depending on these reported data. And if it's not fair data, if they're not statistically different, if they're not well adjusted for the case mix or the population the organization or the doctor serves, then the public may be misled. Finally, there's an element of public safety here. If an organization or a hospital, let's just say, has higher rates of central line or related bloodstream infection year on year, and it's statistically worse than all the other hospitals in the country, that requires some accountability. We have to go to that hospital and say, can you explain why your rates are so high? If they have a great explanation, they're really different, their patients are that much sicker, fine. But if they don't have a good explanation, then we get into accountability. How do we hold them accountable for their performance, which is in fact not up to standard? So that's what I mean by measuring for judgment or measuring for accountability. It's complicated. It's got a scientific basis. It better be done well. Otherwise, we're not being fair and we're not actually operating in the spirit of improvement.